This video is for waxing the client, and we are going to go over the steps throughout the process. And before you even greet your client and set your client up, you arrive to work and you have to do your hand wash. So we wet our hands and we find the liquid hand soap. We wash them on the front and the back down to the wrists, the fingers, the backs of the fingers, between the fingers and the thumbs. We're doing our fingertips and nails. We do our thumbs and our wrists, minimum of 20 to 30 seconds, and then we rinse them under the water. We grab a disposable paper towel to turn the water off, and then we completely dry our hands off. And when we're completely dry, we find our hand sanitizer and we sanitize our hands. And then we are going to prepare our workstation for the day because we need to set up. So in order to prepare our workstation, what we need to do is disinfect our workstation, bed, and equipment using a disinfectant wipe following the manufacturer's instructions. We're going to check our equipment to ensure all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean, closed container, and then we'll dispense products that we need for the service. So we're going to prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray. Or you can remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup or tray on the tray. Then we will place disposable table paper on the disinfected bed to ensure that the wax does not fall onto the bed. And what I'll probably do is move my tray to the other side of the bed because I don't think otherwise that anyone will be able to see it. So that's probably something that I need to do now. I can turn it, but if it's over there, it will be probably so much easier because it might actually be in camera line, or it might actually be covered up. Oh, it might be covered up. Okay, so let me bring it back just so I can show everyone what is on the tray that I have prepared, if possible. Camera angle is not great, apparently, but I wanted to show the work. So, okay, so here is the tray. Maybe here's the tray with the setup. So what we have set up is cotton rounds, tweezers, antiseptic, powder, wax, remover, soothing antiseptic, gloves, all of our wax sticks and strips, small scissors, disposable applicators if needed, tissue, and paper towel. So the setup is there. It's that seeing me work is here. So let's figure out how to adjust this camera. Okay, I promise I'll fix it before the next video. Ugh. Hopefully that will work for now. Try to tighten it up a little bit. Sorry for the roller coaster. That might help. There. Okay. Whew, sorry about that. So then you're going to greet your client, and of course you're going to greet your client with clean hands. So let's talk about that. So we greet and escort our client to the workstation. We assess the client's current style, determine the client's preferences. We assess the client's needs. We assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, i.e. lice, to prevent from safely performing this service. We assess the client's consultation form for any medications and products used within the last 72 hours. We consult on any known allergies. We consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. We assess if the client is prone to cold sores or fever blisters. We assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, or hydroquinone, etc. We assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers, and if the client is free from the above, we can move forward with the procedure, which she is. We know that. So we're moving forward, and we're going to get her ready before we wash our hands. So we're going to get her comfortable. So I have laid down that paper drape. She's going to get both her eyebrows and her lip waxed. So she has been covered, and I'm going to place a rolled towel underneath her head and give her an additional cover here. We're going to pretend like this is a cape so nothing gets on her, and then I'm going to do like a headband. This is a hairnet to get her hair out of her face and out of the way so that no wax will get on it. And once she's nice and comfortable, then I'm going to wash my hands. So we're going to get my hands wet, and we're going to take that liquid hand soap. We're going to rub our hands together down to our wrists, the backs of our hands, our fingertips, the back of our fingers. Of course, we're washing everything between the fingers and the thumb, those fingertips and nails, thumbs, and we wash our wrists 20 to 30 seconds minimum under the water. We identify a clean towel or those disposable paper towels to turn the water faucet off. Dry thoroughly, and when you're thoroughly dry, get that hand sanitizer, 70% ethyl alcohol, and we're going to dry it up. And make sure your hands are really dry because this is a glove service, and you're going to have to apply gloves when you are doing the waxing. So we are going to go ahead and do that once our hands are dry. You saw our cart, so there's our disposable gloves. We're going to put those on. And I will be testing my wax in just a minute, but I want to go ahead and just assess her hair growth. So what I'm doing now is we're starting with the brow. So I'm just going to look at that and take a minute here to figure out where you need to remove, what you want to leave, which way the hair's growing. Looks good. And before you can even start anything, you're going to test the wax. Then we're going to clean and prepare her. So I've got my wax, and I have a little spatula, and what I'm going to do is take a little bit of the wax, and I'm going to try it on me first to make sure I think it feels comfortable. I'm going to throw that away. It does. Let me get my little wax strip to remove it. And I think it feels really good. So I'm comfortable with putting it on her, which is great. So the first thing that we need to do for the brow service is we're going to remove anything that we just assessed that growth, any makeup, any oil, anything. So we're going to take care of that to prepare that skin area up here. All of that around the brow. We've got to get it nice and clean. She might have some eye cream, some makeup. So we're going to do that on both eyes. And then we have to make sure that it is like the driest area ever. So we're going to dry it, and we're even going to apply just a teeny bit of powder. You don't want any, you want to protect. So we're just getting a little bit of fuzz off there from the cotton round. And we are going to go to the other side with a little bit of powder. Everything's nice and dry. Okay. So we're gonna get started on the first. I have checked that temperature. Feel really good about it. Strip, and I've applied the wax with the hair growth. I'm going to remove it against the hair growth, and I'm going to pull the skin nice and tight before I lift and then press. I've got another area that grows a little different right here. I'm going to hold the skin nice and tight, lift and press. Just giving it a little relief there from any pain. I'm going to go to the top of the brow now. Let's get nice and tight. Tight. It's good. I'm going to grab some remover here now. Remove any wax residue that might be left on the brow, and I am going with the hair growth pattern when I do that. And I'm going to find my tweezers because there's a little bit of cleanup that I need to do on this brow. Not bad though, she was good. The wax did really well. Just a little few baby hairs that I want to make sure I get to really maximize that shape how she likes it. Good. Toss that. So now we're gonna move on to the other brow. We've powdered it, it's dry, it's ready to start the wax process. We're gonna soothe at the very, very end when we finish everything. Let's get nice and tight. Let's get nice and tight. Awesome. Beautiful. So I'm going to remove any extra wax, if there is any there. Once again, I see those few stray hairs that I need to address. Tweezers. Awesome. And now we have this midsection of the brow here that we need to get, and the hair actually grows down, so we're going to be applying the wax down and going up. So finding that nice tight skin, press. And remover. And tweezers. And you always want to tweeze in the direction of the hair growth. It just comes out easily and it's more comfortable for the client. You're getting the hair out actually and not just breaking it off. Beautiful. And then we need to go through with that soothe process. So we're going to finish up with our soothing. Finish here for the whole brow before we move down to the lip, because the brow's done and it looks awesome, so we're going to calm it down. She was great. Once again, I'm going in the direction of the hair growth, applying this. Nice. And now we're going to get in there for that lip. Okay. So same thing, we're going to assess the hair growth, direction of the hair growth. We're going to be removing the hair on top of the lip, on the little sides here, and in between the lip there. So we've got some outs, some downs to dress. So let's clean it. We're preparing that area for the wax. And you remember you do not want it to be wet. So once we've cleaned it, we're going to grab some of that powder, and that really helps protect the skin too. And it makes the surface very dry and much nicer to do your waxing on. So she's ready for her wax. I'm going to start on this side. And I'm breaking my sticks in half. I would never do this in salon. It's just because we're doing these videos and I need to conserve sticks. Because obviously I use it once and it's a disposable. It has to go away in the trash immediately. Hold that skin tight before I ripped. Now I'm doing the press. Nice tight pull for the skin. A little bit. And we're going to go right to the other side. We're going to get the whole lip over with, and then we're going to remove and do the tweezing after. Smaller area, it's not like two brows, so it can be a little painful. So we're going to knock it all out before we get to the finishing touch. So what we're going to do is we're going to hold the skin tight and pull and then press to take the little sting away. Going against the grain of the hair with the pull, but spreading down with the grain of hair. So going with the growth of the hair, and then we remove going away. And once again, whole nice little skin, nice and taut. Beautiful. So we have one little area that's left, which is the center of the lip here. Behind her. This area is, it can be a little painful. I've had this done a lot. This procedure done a lot in my life. It's not that fun. All right, so we're gonna keep that skin nice and taut. And it's done. She's probably thrilled at this point. Okay, so now we need to remove any excess wax before we go in there with our tweezers. She was a real trooper and she looks great. Skin did really well. She's not new to this. She knows. Okay. So get your tweezers and then you can get in there and see if there's any remaining hairs that you need to remove. I see a couple. And I'm removing them with the direction of the hair growth. It just pulls it completely out and it doesn't break the little hair off at the skin line. Pulls it out of the follicle. Nice. So to the other side. It's really amazing. These little, it's right under the nose. So hard to get those hairs. Doing a little tweezing, so she's happy because she has to come get this done way too often and she likes to have it really clean when she leaves. Beautiful. And we need to give her a little soothe. So that's the final step on this, is that we get to the soothing, which is what we're going to do right now for her beautiful skin. And I mean, gorgeous. So I'm going to show her how amazing it is and how her brows are shaped. Oh my gosh, she loves it. She can't take it. It's gorgeous. So let's talk about what happens now. So we are going to talk about maintenance and aftercare, and then we'll get her checked out and maybe booked for her next appointment because she's thrilled with the results. So let's remove our gloves because we are going to check her out. So we're going to take care of our disposable gloves. And then we would, once she's checked out, we're able to go back to our room to finish and just start the sanitation disinfection process. So what's going to happen now is we're going to discard any single-use item, such as those sticks for the wax, or wax papers, or tissue, anything like that. Any single-use item is now going in the trash. So that's what we're doing. And then we're going to place our implements, like the tweezers, into a closed container that is labeled to be disinfected. Then we are going to place the things that we used on her, the roll towel, the cape, this towel, headband, etc. We're going to take those and place them in an area that's closed until they're laundered. And then we're going to clean our work area and disinfect. Identify proper cleaning agent and read the manufacturer's directions. Following manufacturer's directions for mixing and usage, wipe down our workstation area with a cleaning solution to remove debris. Then we identify a disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in a salon setting. Following the manufacturer's directions for mixing and or using appropriate aerosol disinfectant, we disinfect electrical equipment, store it in a clean area separate from other implements, and then we wash hands. Remember, we have to take gloves off again because we were working with our wipe down with the bactericidal, virucidal, and fungicidal. We wet our hands, we find the liquid hand soap, and we're going to do that quarter size on the palms, on the back of the hands, the fingers, the back of the fingers, between the fingers and the thumbs, the fingertips and nails, thumbs, wrists, and we do that for a minimum of 20 to 30 seconds. Rinse your hands off and then identify a clean towel or a disposable paper towel. Turn the water off with that paper towel. Then dry your hands nicely. Once everything's super dry, you find that hand sanitizer that has that 70% ethyl alcohol. Go for it with your hands, and you are ready for your next client and or service. And this concludes the video for lip and brow wax. Thanks.